Thomas. Okay, and then you are, Mark.
Well, good morning. My name is Mark Parkinson. I'm the President and CEO of the American Healthcare Association. We're the largest trade association for long-term care, representing almost 15,000 skilled nursing facilities and assisted living facilities across the country. The really good news that we've been able to share over the last couple of years is that since the vaccine came out in December of 2020, we have had a dramatic improvement in the clinical situation of residents that live in our buildings. There's been ups and downs of COVID and surges and then declines, but in terms of mortality and serious illness, you can really trace back to December of 2020 and January of 2021. Providers have done an excellent job at keeping people safe and for the most part healthy, and there have been minimal number of hospitalizations, and there have been deaths, but thankfully much lower than what we experienced back in 2020. It would be a mistake, however, to assume that that means that we've completely recovered from COVID. We have not. COVID had a devastating impact on long-term care in a whole variety of ways. From a mental health perspective, the impact has been dramatic. What our residents and employees faced in buildings was significant and will be long-lasting, and we're going to have to work our way through that. On the operational side, we continue to be challenged by an incredibly challenging problem of workforce. Before the pandemic started, there were over 1.5 million workers in skilled nursing facilities. As we stand here today, there are almost 200,000 less workers in skilled nursing facilities, yet the need for them is even greater. This has caused massive operational problems for folks that are trying to run buildings, trying to recover from the pandemic, at a time when they just don't have the staff to do so. We've been monitoring this situation very closely, and one of the ways that we monitor it is through surveys of our membership to determine exactly what's happening in buildings. So I'm here today to report to you on the results of our most recent survey, and then I'll give you the top line numbers. I think what's really way more important to understand the magnitude of this is to hear from providers, and you'll hear from 3 providers today that can talk with you about the challenges that they're actually facing in buildings. So we recently conducted our survey of 400 nursing homes across the country, and the results verify what we've been hearing from members for the last year or so, which is that the workforce problems and challenges continue. 95% of the respondents have indicated that it's still difficult or somewhat difficult to recruit new staff, and that's despite the fact that 95% of providers have increased wages. Nearly 1/3 of nursing home providers have indicated that their workforce situation has actually gotten worse since the end of 2022. And all of them are having staff work overtime, extra shifts in order to cover the gaps that are out there. Many continue to use agency staff, with 75% reporting the use of agency. That's the top line numbers in terms of workforce. In terms of challenges that it creates significant access problems. More than half of the respondents have indicated that they have had to restrict admissions. Others have shut down entire wings. And as we've discussed before, hundreds of buildings have closed since the start of the pandemic. This, of course, causes financial challenges. Buildings and operators have had to increase wages significantly in order to keep the staff that we do have. And that's, in some respects, a good thing. We're finally getting to the point where frontline care workers are earning a living wage. But the problem is that state legislators in every state have not kept up with those increases in inflation with corresponding Medicaid rates. Now, the good news is that there are solutions to this, and AHCA NCAL proposed solutions as early as the start of 2021, and we continue to push those ideas. At a very high level, the very best and most immediate solution would be comprehensive immigration reform. There are hundreds of thousands, possibly millions of people across the globe that want to work in the United States, that would be good citizens and that can do the work that we need to have done. But unfortunately, the political dynamics in Congress have not come together to allow for passage of comprehensive immigration reforms. There are less steps that can be taken, though, that would also be helpful. So we have advocated for and will continue to advocate for a visa program for healthcare workers that we think could bring in tens of thousands of CNAs, LPNs, and RNs into the country. There are also two specific pieces of legislation that have recently been introduced in Congress: the Building America's Healthcare Workforce Act and the Ensuring Seniors Access to Quality Care Act would both be very helpful. One would allow for an extension of the temporary nurse aid program that was so effective in attracting workers in buildings during the pandemic. And the other would allow for CNA schools that are based in long-term care facilities to continue. Right now, too many of those are being shut down, and those programs need to continue. So there are solutions out there. We need help. We need Congress and the administration to coalesce around this sector and provide solutions to our workforce problems. Now, I'll just say as an aside, in the face of all of these workforce challenges, it's disconcerting to know that in the next couple of weeks there will be a proposed mandatory minimum staffing requirement from the administration. We're not against having more staff in our buildings. We want more staff. The problem is the staff are simply not out there. The hundreds of thousands of people that we need to work in our buildings to get us back to pre-pandemic levels are not out there. To now punish providers that are unable to hire staff, it makes no sense. It flies in the face of what's actually happening on the ground. So those are the high-level numbers, and again, I think the most effective message will come from providers who can tell you what they're actually facing. And I'm proud to introduce our first provider, Sarah Schumann, who has a building in Colorado, who heads our independent owners group at the American Healthcare Association, and I think can do a really good job of explaining what's happening in the real world. Sarah?
Thank you, Mark. Good morning. My name is Sarah Schumann, and I'm the owner-operator of Brookside Inn and Brookside Rehabilitation and Wellness in Castle Rock, Colorado, just south of Denver. I'm honored to be here today to share a little bit about my experience as a long-term care provider and the current situation we're facing. You could say that healthcare is in my blood. My parents, grandparents, and great-grandparents all worked in various sectors of the healthcare field. I was a teenager when I helped my father build his first long-term care facility, and I haven't looked back since. Today, my father, my brother, and I run our two facilities, so we are truly a family-owned and operated business. We are incredibly grateful to be on the other side of the COVID-19 pandemic. It was an intense 3-year battle, and while our circumstances have improved, we are still in the process of rebuilding. Financial and workforce challenges are considerable obstacles for our facilities. For our skilled nursing facility, Brookside Inn, 85% of our residents are on Medicaid. As we all know too well, Medicaid reimbursement rates do not fully cover the cost of care. We were losing $16,500 per resident per year because of inadequate funding. If you quickly do the math, you can understand how this would put us in an unstable financial situation. In addition to the low Medicaid rates, the aid we were receiving through the public health emergency has ended, leaving us without any additional lifeline. Needless to say, it has been difficult keeping up with the rising costs. At the same time, we are also struggling to recruit caregivers while anxiously anticipating an unfunded federal staffing mandate. In the last 3 years, I lost 4 nurse managers due to retirement and burnout. Collectively, these managers had more than 50 years of experience and knowledge with my organization alone. To put it in a greater perspective, for 3 months in 2021 and 2022, one of our buildings had no cooks. Our other departments were managing on top of their other duties. Even our local Taco Bell couldn't staff and was in the same predicament and could only operate between 11 a.m. and 7 p.m., 5 days a week. We have taken proactive steps to hire more staff. We began offering full health care benefits for our staff and their children, as well as flexible schedules. Despite competition from other healthcare sectors and industries, Our efforts have helped us maintain employment and hire more caregivers, but our workforce levels are not optimal. We are unable to hire at the same levels of registered nurses we historically have. We have hired new licensed practical nurses graduates, and while they are compassionate and competent individuals, we spend more time educating and mentoring our nursing staff than we have needed to historically. The staff education requires more work from an already overextended nurse management team, and I am concerned about their well-being and retention with our organization. What worries me about an arbitrary staffing ratio is that it will do nothing to help build our talent pool and only add to our costs. How will we find these workers without resources when Medicaid is already underfunded? These are the questions that so many providers are asking. A nursing home cannot raise its rates or adjust its hours. We are open 24 hours a day, 7 days a week, because we take care of our most vulnerable citizens. We can only do so much on our own. Policymakers have an opportunity right now to strengthen long-term care for the sake of our seniors and our caregivers. We appreciate that in Colorado, Governor Polis approved a Medicaid rate increase this year, and we are optimistic that this funding will better match our financial expenses. However, our costs are still increasing. Improving the Medicaid reimbursement system for all will truly give long-term care facilities the resources that they need to continue providing high-quality care. In addition, we need to create direct incentives for healthcare professionals that choose to work in long-term care. Programs such as tuition assistance, loan forgiveness, and tax credits can help us get people in the door and begin to build a stronger workforce at the ground level. 3 of my grandparents were cared for at our facilities, so I have a unique perspective of being an operator and a family member. I can tell you that the long-term care is one-of-a-kind profession, and our elderly population and the people who care for them deserve our support. We came into the pandemic with long-standing challenges, and we need to leave it with solutions. Thank you. And I'd like to introduce my peer and colleague, Nate Shima.
My name is Nate Shima, and I'm the President and CEO of the Good Samaritan Society. Thank you all for being here today. The Good Samaritan Society is the largest not-for-profit provider of care and services and serves in over 200 communities in 22 states. With 140 nursing homes, our skilled nursing services are the biggest portion of our business. 70% of the skilled nursing residents we serve live in rural communities, primarily in the upper Midwest. In 2019, we merged with Sanford Health, the largest rural health system in the country, which allows us to provide the full continuum of care and services to our residents and our patients. I have served my entire career in senior care, and even 17 years ago as a brand new administrator in rural New Mexico, I've never experienced staffing challenges like we've seen today. Across our skilled nursing facilities, nearly 2,000 positions remained unfilled, which means we would need to hire an average of 13 employees in every building to meet our current needs. While we face staffing challenges in nearly every community, finding qualified caregivers is even more difficult in rural areas. Like in rural community of Miller, South Dakota, where the position for a permanent night shift nurse has been open for 3 years. International recruitment is a part of our long-term strategy at Sanford Health and the Good Samaritan Society to strengthen our nursing workforce. This year, we intended to onboard 300 internationally trained nurses at our medical centers, critical access hospitals, and skilled nursing facilities. Unfortunately, the recent visa freeze announced by the State Department will reduce our recruitment efforts by 45% this year and even more next year. Where we cannot fill open positions, we have been forced to turn away seniors who need our care because we cannot find staff to deliver that care. Closing a location is always a last resort. But unfortunately, we've made the extremely difficult decision to close 13 facilities in the last 2 years. Most were in communities with populations of 2,000 people or less. These communities needed our services, but when considering the challenges of finding caregivers and inadequate Medicaid reimbursement rates, there was not a sustainable path forward. We worked around the clock to support the residents during these transitions, But still, the closures were devastating and disruptive to our seniors and their families. In some cases, the next closest facility was an hour away. If CMS proceeds with an unfunded minimum staffing mandate, our nation's seniors living in rural areas will pay the price. There are simply not enough workers available to meet any requirement to increase staffing levels. We would love to welcome more staff at the Good Samaritan Society family, but increased staffing requirements will not create the caregivers we need to fill open positions. Setting unattainable staffing ratios will result in seniors having fewer options for care close to home due to closures and reduced admissions. This would also be a tipping point for hospitals that already have difficulties discharging residents to long-term care settings due to the staffing crisis. With both challenges and opportunities confronting us, our industry sits at an important crossroads. Our partnership with Sanford Health has made us stronger as an integrated health system and has allowed us to prioritize initiatives to attract, retain the caregivers we need today and cultivate the workforce we need tomorrow. Since the pandemic, we've launched creative workforce solutions and made historic investments in our people. This includes pay raises, bonuses, flexible scheduling options, benefits, well-being support, and training programs for our leaders and our caregivers. While modest, we're seeing some job recovery across the society. Our turnover rate has lowered, and employees consistently tell us the work they do is meaningful and their residents are their family. An unfunded minimum staffing mandate will undo the progress we've made. We need CMS and our elected officials to invest in and strengthen the programs to attract, retain, and grow the long-term care workforce. We care deeply about our residents, who are family to us, and are eager to continue to work with CMS on meaningful workforce solutions. The bottom line is that an unfunded staffing mandate will reduce access to care for seniors in rural America. Is this a reality that our country is willing to accept? Thank you. I'd like to turn things over to my colleague, Colleen.
Good morning. My name is Colleen Condon, and I'm a second-generation long-term care facility owner in Vermont. I am grateful to speak to you today about the crisis we are facing, and also speak to you about my unique struggles as an independent provider in the Green Mountain State. I have been a long-term care administrator for more than 25 years, and caring for our most vulnerable population is truly my passion, and something I am grateful my parents passed down to me. Unfortunately, as you've heard from Mark Parkinson's and others today, our sector is facing an acute workforce crisis. And the Biden administration proposed unfunded federal staffing mandate will make matters worse. I am here today to urge lawmakers to understand the critical issue at hand and to focus on supportive policies that will meaningfully help providers like me recruit and retain a robust workforce. I previously owned 3 long-term care facilities, 2 skilled nursing facilities, and 1 residential care facility, all of which face staffing challenges. In 2021, I was forced to close my residential facility because of workforce and financial challenges. During the COVID-19 pandemic, the long-term care sector struggled because we did not receive as much federal assistance as other healthcare facilities such as hospitals. I own 2 of the 38 total skilled nursing facilities in Vermont. Not only am I competing with the other facilities for caregivers, I'm competing with myself. There simply are not enough workers to go around. To make matters worse, Vermont has an extremely low unemployment rate of 2.4%. While it's great for the state, for facilities lacking caregivers, it means there aren't enough people to fill open positions. I had to resort to staffing agencies, and the costs were tremendous. I was spending more than $1.5 million on agency staff who are temporary and do not know our residents intimately. It wasn't up to our standards. That's when I had to say enough to staffing agencies and raise my wages to try to attract more workers. Among professional nursing staff, we went from 15 agency staff to now down to about 2 professional nurses at my facility. We also reduced direct care agency staff, going from 14 agency licensed nursing aides to now around 6. No facility should resort to expensive staffing agencies, but so many of us are backed into a corner without being able to fill our staff on our own. Yet staff vacancies have forced me to limit resident admissions. It's really a double-edged sword. I can either limit resident admissions or hire expensive staffing agencies. Limiting admissions bleeds into our other healthcare sectors. The commissioner and hospitals have called me asking if my facilities have room because nearby hospitals are full and experiencing bottlenecks of patients waiting to be discharged to post-acute facilities. Without enough staff, we cannot accept new patients, which strains the entire healthcare system. We truly have a crisis, and the proposed federal staffing mandate will exacerbate the situation. All long-term care residents and facilities are unique and need to be staffed accordingly to their specific needs in various specialties. A one-size-fits-all requirement will only force nursing homes to use expensive staffing agencies, which is bad for patient care and unsustainable for our facilities. Lawmakers should instead advance supportive policies that will build a strong pipeline of dedicated caregivers. As a provider, I try to create a career path for students coming out of school, incentivize them to join the long-term care workforce. For example, I have assisted several of my caregivers to get into Vermont Technical College and supported multiple caregivers to become licensed practical nurses, registered nurses, and even nurse practitioners. Our state has also implemented a focus program for long-term care nurses to start their careers. Federal policymakers should look into these as examples of meaningful solutions we could replicate nationwide. Help us build a workforce that is strong for years to come, and ensure our nation's precious seniors continue to have access to the high-quality care they need and deserve as they live out their golden years. Thank you. Let me turn things back over to Mark Parkinson.
Well, thank you very much. Staffing requirement that would punish facilities for being unable to hire people that aren't out there will make things worse. It will cause beds to shut down. It will cause wings to close. And unfortunately, it will accelerate the closures of nursing homes. So I know that the folks that want to do this are well-intentioned, but the results will be the opposite of what they want. Seniors will not be benefited. They will be hurt because access will decline. So, very happy to give the good news that the clinical picture is still good. Unfortunately, have to deliver the poor news that the workforce problem remains, but working together with Congress and folks that really want to solve this problem, we think solutions are out there. Thank you very much for covering this very important issue. All right, great.